got that doubt regarding how many lateral canals are in a tooth? Well, I'm Dani Mancuso, specialist endodontist and prosthodontist, and I'm here on the 26th episode of the Diary of an Endodontist, and I'm going to show to you. Well, if you are trying to find how many canals using a conventional x-ray, that is impossible, unless that lateral canal is really large for you to be able to see it. That tooth was referred with a very large radiolucency, and the dentist couldn't reach the end of the root. And do you know why? Well, let's check this 3D scan together, shall we? It's a lot more predictable when you see the 3D scan. The anatomy of those canals are more visible to you, and the presence of large lateral canals, you can see them as well. So you can see here those lateral canals and those curvatures of the main canal. But are the only ones, are those the only lateral canals in that tooth? That's what we are going to check. Well, the answer is, unfortunately, that you'll never be certain. The only way for you to know that you've done enough in terms of your disinfection is when you see some lateral canals filled with your sealer. However, have you obturated them all? I doubt. I don't think so. It depends on the width of those canals, but hopefully you've done most of them. And as you can see in this x-ray here, there are so many. Look at them over here. Several lines. The main canal dividing into, the main canal dividing into, and lots of accessory canals like lateral canals. And all of those are compromised and infected, and they are feeding that big infection. So as more as you disinfect, better for this tooth. And if you've done enough, you will be able to see the healing starting. So that is a review, 3-month review, where you can see the bone refilling that space. And I normally say to the patient, if you've disinfected enough, in the absence of bacteria, the bad bacteria causing that infection, the bone is going to grow back again, and it will carry on growing unless there is something compromising again, like a fracture or something like that, or like a reinfection, a leakage under the crown. But if you've done enough, you've sealed that tooth properly, and there is no coronal leakage, that tooth should last for a long time, and the whole area should heal beautifully. And in the next episode, I'm going to show you what you can do to enhance your disinfection even more. So don't forget to sign up and to stay tuned for the next episodes. See you soon.